The doctors and clinical staff at Children's Hospital Los Angeles recognize it takes more than medicine and bandages to make a child well again. The Mark Taper and Johnny Mercer Artist Program seeks to cure not just the symptoms, but help to heal the whole child through exposure to art, dance, drama, and music.
Michael normally does respond to music. If his eyes are closed, sometimes he'll open them, and sometimes his eyes will follow the sound.
Yeah, for Michael, music therapy really helps with his heart rate, and you can see on the monitor that his heart rate has dropped at least 20 points since being here. It goes down almost every time and he relaxes. He uses the music a lot to help him before surgery. We sing songs that he's a fighter and different things like that.
Usually in pediatric hospitals, you might find one music therapist, you might find one art therapist, but we actually have a whole team of art, music, and dance therapists here, and we actually have a nationally renowned training program for art, music, and dance therapists. So people come from all over the country to train here. The program consists of everything from the artwork on the hallways that you'll see, the patient artwork, to musicians playing performances all over the hospital, to the true heartbeat of our program, which is the art, music, and dance therapy. We're able to reach patients of all ability levels, regardless of whether or not they're able to communicate verbally. We're able to meet them with the arts.
Most of the infants in the NICU are pretty ill, and the old dogma used to be that in order to make them stable, we have to isolate them and shield them from any outside stimulus and sound and noise. We're realizing more and more that if we provide developmentally appropriate sounds that mimic their vital signs, sounds that they might have heard in the womb before they came out, that actually provides benefits, medical benefits and developmental benefits that we didn't realize in the past.
We've actually found that art, music, and dance therapy helps lower pain perception with our patients. Oftentimes when patients are refusing everything, they're not taking their medication, we can get in the door sometimes when other people can't.
Get you to remove all the pain that you're feeling and put you in a positive place.
Emotionally, physically, mentally, it just takes away all the pain and the frustration. I do a lot of art. There's so many things you could do here, like dance movement, arts, and they have so many things that are here that takes you off it takes the pain off your mind.
Something else that makes our program unique is we combined the expressive arts therapies with artists and musicians from the community that come in and volunteer their time. From the outside looking in, it's easy to look at our program as something that is just fun and joyful, but not necessarily a significant part of healing. But here at Children's Hospital Los Angeles, it really instills and encourages emotional and physiological change.
Another design for helping kids deal with the stress of illness and hospitalization is the Child Life Program.
Our goal is to help kids cope with being in the hospital. And whatever it is that they might need, whether it's distraction through playing with toys or understanding why they're in the hospital, our role is to really kind of assess what those needs are and meet them where they're at. So we have a playroom here that's open several different times during the day. Kids get to come here and enjoy activity. They get to be in charge here. In their rooms, doctors, nurses, people are telling them what to do, what to eat, what to not eat. They come here and they really have choice to play and to simply be kids here. And for a little while kind of forget that they're in a hospital or getting medicine or having a surgery.
That playroom is actually wonderful. They go in there and they do what kids do best, just be kids. They have to play with Play-Doh, little games. They have doll houses to play with. And then what my daughter likes is the little activities, little arts and crafts that she could be able to do and decorate her room with.
One of our goals here, we want to give kids that chance to play because we know it's an outlet for stress for them, and it's also a way that they come to understand and make sense of their world. So they engage in medical play, where with the doctors and with real medical equipment and baby dolls, they're actually acting out experiences that they're having here and coming to understand and cope with all the things that they're experiencing themselves.
My daughter got diagnosed with AML, leukemia. It's just we're taking it day by day. She just finished her 10th day of chemo, and it's going to be a total of 40 days of chemo. She had asked one of the workers right here to help explain to her, how to explain to her cousins what she has so they could understand. And they actually sat down and explained everything until she got it. And she was able to explain it to her cousins. So it's a wonderful place, man. It's hard to explain here. You get real choked up, especially with going through everything we're going through here. They help you go through everything. You know, they help you make it a little easier, help you understand. My daughter right now, what she's going through, it seems like she's strong. She's so strong. Even when I want to stumble and just break down, it seems like she'll hold me up and just tell me, hey, it's okay, Dad. We're gonna go through with this. So, yes.